Male pelvic floor therapy, what to expect? That's the subject of this video. Hi, I'm Dr. Shaki from Core Pelvic Floor Therapy right here in Irvine, Orange County. This is a very, very common question that I am asked, and it's a reasonable one to ask because a lot of times when men start looking into pelvic floor therapy, they see, I'm not so sure if this is what I want to be done on me, but I've got this issue. Is there an alternative? The reality is what I do with pelvic floor dysfunction is an alternative, but in my opinion, it should be the mainstream and not the alternative. Let me explain to you. Here's your pelvis, and the stability of your pelvis is so crucial for your existence. This is a foundation for the structures above. It's connected to your spine, so the stability and functionality of your spine impacts its stability. You've got your lower extremities, your legs, that are connected to this, so their lack of performance will impact its stability. And of course, your breathing, because when done correctly, the way babies breathe, we are impacting the muscles of these inside the pelvis. Now, why is that important? These muscles work with the outside environment of the body to stabilize this. So it's a double reinforcement for stability purposes. When things are not happening on the outside up to par, they have to react accordingly. They need to provide extra support. In this area resides the bladder in the front, prostate in the middle, and intestine in the back portion of this hole. So as these muscles are getting tighter because of what I just explained, the room for these structures decreases. A compressed internal organ is not going to function well. It's going to speak up in a different way. It may have symptoms like dribbling that would typically not get the person, the male individual, into an office because it's like, it's not a big deal. But then the moment it changes their penis sensation or issues with sexual performance, now all of a sudden they're like, oh my gosh, this is emergency. So there are symptoms you're having or you have had that did not necessarily lead you to seeking care. So now you can also have issues with constipation or dyssynergy of the muscles that have to relax or contract in order for, let's say, the bowel movement to be through a normal, natural, healthy process. So you can have different symptoms impacting the internal organs. You can have symptoms related to the nerves because those nerves, see these yellow things? Those nerves go through this tortuous path through tight muscles in this case that can add compression into it. So now onto the nerve, and then the function of that nerve, the end organ is going to be compromised. Like the very typical nerve you may be familiar with is pudendal nerve that goes all the way from your sacrum back here, and it goes through this area and it goes to the penis, perineum, and anus. So you can have sensation in those areas. So I'm not going to talk about the different symptoms of pelvic floor dysfunction, but I'm telling you that when it comes to male pelvic floor dysfunction, what to expect varies. When you go to a pelvic floor physical therapist, a high majority of times, it is through digital examination and work on the inside through the anus that a lot of work is done there. Some breathing is encouraged, Kegel is encouraged, which I'm 100% against. Reverse Kegel is encouraged. I'm 100% against that. I've done videos of that. If you have not subscribed to my channel, please make sure you do so because I generate these videos quite often and it's a different perspective on what's happening here. So my issue with that approach is what if the tightness is beyond where my fingertip is going to go if I'm going through the anus. If I'm going through the anus with the hopes I'm going to touch something that's tight, that's causing an issue, what if it's just a little bit farther away from the tip of my finger? So how does that work? And how come not everyone has this issue? And how come that's the solution? How come I wasn't born with the solution? When you look at it from biomechanical perspective, when you look at why this muscle gets tight, as an example, you very quickly realize that this is not going to do the treatment. It may make you feel better, but it doesn't take away the dysfunctional patterns of movement that were created as the result of pelvic instability. So what's the fix? The fix is going to be working on biological breathing, working on learning what movement patterns look like. And that blueprint of movement is, by studying human babies, we see every child on the planet Earth, every walking human being on the planet Earth has gone through the same stages of development. It's so precise that we have charts that we can say, oh, well, your child is not going based on the developmental chart and tables. So that is the manual. I have the manual. I know what keeps the muscles inside of this pelvis is the proper breathing. I know it. If I provide the fertile ground, the reason why this is tight is going to go away. What timeline, I can't tell you because everyone has a different story. But what I can tell you is when I address the why, the main why, all these symptoms start improving. So what to expect depends on who you go to. If you're coming to my office, I'm working towards pelvic stability to take away the reason and the excuse why this gets tight. If you go to another office, and majority of offices, that may not be the case. I hope this makes sense to you. I hope you realize that not everything that is done out there is or mainstream is necessarily making sense. And if it doesn't, keep asking the why questions. Now, if you have any comments, any suggestions for videos, or any questions, make sure you put down in the comment section below. I'll take a look and see if I can answer them or if I can do more videos on that. Now, if you need help, use one of the methods of contact in the description box to contact my office. Let's see what's going on. Until next time, take care.